3 surprising signs of sexual dysfunction in women and how that shows up in the bedroom. That's what I'm going to discuss today. It's Dr. Debra Durst, and welcome to the channel. I am a regenerative medicine specialist with a focus on sexual wellness for both men and for women. And so today I want to talk about female sexual dysfunction. How common is it? What it is? What causes it? And what can we do to fix it? But most importantly, how does that show up in the bedroom? So female sexual dysfunction can happen at any age, but it's very common. About 41% of women will have it. And it can show up in a lack of drive where you just don't have an interest in sex, or it can be that we don't have the arousal that is needed or once was present, or maybe our orgasms are not as strong as they used to be. And then the worst case scenario is all of that or something else is causing pain or discomfort with sex. And so when that happens, how does that show up? So a lot of times something is happening in the bedroom. Maybe just the woman is noticing it. Maybe both are noticing, but it's interfering with satisfaction in sex and sometimes interferes with the relationship and the health of the relationship. So avoidance of sex is one of those signs that a woman might have something going on. So they're just avoiding it because they don't have drive. Maybe they don't have drive and it's always been low, but it's bothersome or it's affecting the relationship, or maybe it's a new change and they used to have an interest in sex and now they no longer do. But there are a lot of medical reasons for that. And what I want to go into is how can we fix that? But what are some other ways that we show up, like that it shows up in the bedroom? And maybe it's still, again, not an obvious problem for men, but maybe women are actually hiding it because lack of arousal is another thing that is very common with women. And so that's actually probably the more common of the disorders for women is they don't get aroused like they should. And so that means that, again, we're avoiding it. Our expectations are potentially low or unmet. And so we just don't pursue it like we used to. And then worst case scenario is they actually have pain or some emotional response around sex. So I'd almost consider that they're bothered by sex. Maybe they don't want to talk about it. Maybe it's not something that they're open to having or open to exploring or having fun with. And it could be that, again, they have pain or dryness. There could be medical reasons for that, or there could be some past trauma around sex. So the 3 surprising ways that it shows up, they're avoiding it. They don't have arousal and potentially avoiding it. Or they have some emotional response you didn't expect, or the woman's having an emotional response she doesn't understand. So what are the causes of this? So hormonal imbalance can be one of them. If there's a persistent problem that's interfering with your sexual satisfaction, you should definitely have your hormones checked. There's only a few things that will really cause low sex drive, especially a change in that, and low testosterone is one of them. So having your hormones checked by a hormone specialist is super important to getting those answers. Medical conditions can cause it as well. So if you have high blood pressure, you're on medications, even birth control pills can cause a low testosterone in women and a low sex drive. And so it doesn't have to be a medical condition. It could be medications as well. Chronic stress is another one. So if you have stress and you haven't dealt with it, that increased cortisol can interfere with your hormone production and therefore your sexual function. And then also even just emotions around it. So if there's a relationship issue, potentially sex is play and then there's love, and you have to almost separate those two out. And if there's problems that are underlying in a relationship, sometimes those are unaddressed, then it comes out in the bedroom. And so lifestyle is another thing. The more active that women are, the more satisfaction they have with sex and the less sexual dysfunction, and that's shown in studies. And then body image. If your nutrition is not the healthiest, or if you're not active, then it also can affect body image, which significantly affects your sexual experience. So basically, how can we fix it? So you can see a hormone specialist that can test your hormones and see where all of those are. And that can be at any age, because you can be in your 30s and on birth control and have a low testosterone or low free testosterone. So you want to get that checked. And so basically, definitely a hormone check just to see. And body composition changes are another thing in perimenopause and menopause that happen, and that affects body image. That's super important. You can do vaginal laser rejuvenations, that if it's an arousal issue, arousal is really a blood flow issue. So the more that we can regenerate, and we use lasers to heat the vaginal canal, the more we can improve blood flow and therefore arousal. And so that's another way. O shots or a PRP injection can also improve, and that's a regenerative treatment we can do. V-tone is a EMS to the pelvic floor that improves orgasmic strength and sexual function in women. And then addressing those medical problems and those lifestyle issues. And then, of course, if there's any kind of relationship issues, addressing those. And if those conversations aren't happening between a couple, then maybe getting a therapist that will actually have those open conversations. And frequently in the office, when we're seeing patients, it's almost like a small group therapy, because sometimes we're seeing men and women together, and at least they're not afraid to have those conversations with us in the office. But if not, you want to find a sex therapist that can address that. So just know that there are medical issues that might be causing you to avoid sex or not be aroused during sex or have some decreased orgasmic strength. There are medical reasons for that. So if there's something affecting your sexual satisfaction, and definitely if that is a change for you, then you want to seek a medical provider that specializes in sexual wellness and hormones, and get a complete picture of your blood work and have everything evaluated, and a comprehensive treatment plan that will result in you having better satisfaction with sex. So hopefully this video was helpful. And if so, just leave some comments. Let me know what you think. Let us know if there's anything else you want to talk about, because we are willing to deep dive into anything wellness or sexual wellness. Thank you.